What up, fellas? It's Ty. Welcome back to the channel where we discuss all things prostate and prostate cancer related. If you're new here, welcome to you. If you've been here for a while, watch the video, maybe even liked and subscribed. I appreciate you. And welcome back. So today we're going to continue on the erectile dysfunction conversation. And I say continue on because I did this 12-minute video on erectile dysfunction, and I'm going to post it just like I did it. I'm not going to edit it or anything, just because it came from a really good place, and it may be a whole bunch of rambling, but please go check that out because it's necessary. But the erectile dysfunction thing I want to talk to you today about has to do with the orgasm. If you talk to anybody and they feel comfortable enough, or maybe they have just done some reading, a lot of people say that the orgasm after your radical prostatectomy feels better or more intense than it did before. For some of you, that may be the case. You may find that it's a little more intense, right? It's nothing holding it in. It's nothing coming out, but it's going to really hit, and you're going to feel an intense, full orgasm. And that situation for you is a mixed bag. Why do I say that? Because you might find yourself fresh out the frying pan into the fire. And the reason I say that is because once you work all the way through all the things that I talked about in the other video in regards to trying to get your erections back, you may find a circumstance where you're now able to get an erection and you're having premature ejaculation. That is how intense that orgasm could be, to a point where you can't hold it or you don't want to hold it. And because of that, you have a significant other that's been patiently waiting for you, or whatever your relationship situation is, and you are in a position now that you actually have an erection and you can't hold it. So I'm here to tell you all, this whole thing is a process. There's a reason why I always say prostate cancer journey. It is not a sprint. It is a marathon. You have to continue to work. You do not get your mind in a circumstance where you are working every single day to get to a circumstance where you are comfortable. Then this is going to be something that's happening to you. You're not going to be able to control this in your mind. So, I'll explain to you what it is that I've read and some of the things that I think that you can do. One of which is you need to make sure that you are aware of this. And then you need to make sure that it doesn't happen in the bedroom. This is not going to go well for you if it does, right? It's just not. You need to make sure if this is happening for you that you know beforehand. That's just my thought. The other thing that you can do is that you have to work this thing up, right? So you have to work up your orgasm and then pull it back. That's like the drill that everyone's talked about. I read is that you work it all the way up and you pull it back to the point where you can kind of control that. Now, I'm telling you from an intensity standpoint, you're probably going to find that that's very difficult at this point. One, because you never thought you were going to be able to do that again. Two, because you actually want to do it. You can't believe that you're actually able to have sex. And then three, you're like, hey, why not? But you need to work this through and make sure that you get yourself back to wherever you were, or maybe in a better position than you were prior to all of this going on. Now, ideally, I anticipate that if you are looking towards any ED issues going away, you got about a year and a half, buddy. Year and a half, right? I'm talking about from your surgery, a year and a half, right? And that means fully making sure and just not even really having real thoughts about it that way, but it's just like kind of working for you. And as long as you are working towards that goal, you should be fine. But doing nothing is not an option. You have to work towards this. It's only my goal to not get in your bedroom, but to make you aware. Because as long as you know, I am very confident that you will do something about it so you are not in a position where your mental health is messed up or that you become in a bad position because of that. All right? Now you know. So, I hope this finds you well. I hope this is helpful. Peace and blessings, fellas.